Hi everyone, welcome to researchmd.com. We got a great topic today and very important topic. There's a lot of things in the news today about the sodium AZIDE in the COVID home kit test and the toxicity associated with it. Children's hospitals are reporting increased incidence of children taking this COVID home kit test and they're getting poisoned by sodium AZIDE, which is a very dangerous chemical. Okay. Again, my name is Pramil. Cheriyath. I'm a program director, internal medicine residency program and transitional residency. I also teach medical students residents, also director of research. And so let's get into our subject. So what is sodium AZIDE? It's an inorganic compound. The formula is NaN3, used for preparation of other AZIDE compound, and it's an ionic substance, highly soluble in water and very acutely poisonous. Remember the word very poisonous. Formula is NaN3, and it's a rapidly acting, potentially deadly chemical. Exists as odorless and white solid. That also make it, when anything odorless and kind of look white, be just very careful. Kid maybe get attracted to it. When it mixed with water or an acid, sodium AZIDE changes rapidly to a toxic gas with the pungent odor. It also changes into toxic gas when it comes to contact with the solid metals also. That is the chemical nature of sodium AZIDE. So the uses, the main, everybody know, I know a lot of people know sodium AZIDE is used in the chemical in the automobile airbags, okay? An electrical charge triggered by the automobile impact caused sodium AZIDE to explode and convert into nitrogen gas inside the airbag. And that's sodium AZIDE is also used as a chemical preservative in hospital and labs, and sodium AZIDE is also in agriculture for pest control also. Remember that word. It's used in agriculture, anything, pest control is a big poisonous substance, okay? Sodium AZIDE in the, what is the role in the COVID home test? In the most of the COVID-19 test kits contain, you got like a nasal swab, then you got a tube called, for extraction of the viral, and then it's got a cap, and then you got a testing card, right? Sodium AZIDE is the lethal chemical which we're talking about today. It's used as a preservative agent in the extraction of the vial of many rapid COVID-19 test kits. Okay, if you look at, according to poison centers, including the National Capital Poison Center and Cincinnati Drug and Poison Information Center and Upstate New York Poison, the test kit contains such a small amount of sodium AZIDE, most people will not become seriously if they come in contact with the chemical. But the problem is with the kids at home. So, what are the test kits? You can tell you the brand names like Binax now, BD Veritor, Flowflex, and Celtrione Diatrust. And then misunderstanding of the usage. The two most common calls the Poison Information Center said carry about home COVID test has been about children. So children's hospitals are reporting lots and lots of people coming in. And adult, we mistook the test bottle for eye drops. So it's very strange. Some adults were mistaking this as a test bottle for eye drops. So you have to be very careful in adults also. So what happens when you swallow? Sodium AZIDE causes low blood pressure, dizziness, headache, and heart palpitation. In case of explosion or direct skin contact, skin burns and there's blisters. Severe cases, you can have seizure, loss of consciousness, death may occur. And the amount of sodium AZIDE, most rapid antigen, is much lower than the amount expected to cause poisoning if swallowed by an adult. But the situation is more different in kids. Okay, always remember that. So management, mainly thing you have to do supportive measures in the hospital setting. So it's very important to call 911 and take the patient to the hospital. Most important, seek medical treatment as soon as possible. If you suspect somebody swallowed AZIDE, do not take the person vomit. For eye exposure, rinse with the 15-20 minutes with the warm tap water. Skin exposure, rinse the skin with the tap water. If skin has swallowed, part of the rapid antigen test is choking, call 911. This is the one, you have to, if you're a kid or somebody taking it, it's called 911, report it and take them to the nearest hospital. Remove your clothing. Quickly take off your clothing that may have sodium AZIDE. Any clothing should be cut off the body instead of pulled over the head. And washing yourself. As soon as quickly possible, wash any sodium AZIDE from your skin through large amount of soap and water. Okay, these are the things you have to do immediately to prevent it. So summary, first aid, skin contact, we talked about, flush the skin with the water for 15 minutes and remove any exposed clothing, close and call 911. Okay, eye contact, using eye wash or flush eyes for like 15 minutes with warm water, hold eyelid open and away from the exposed eye, remove the contact lenses, that's a no-no if present, and then call 911. Inhalation, if you're suspecting somebody inhaled it, immediately move to the area they can have like fresh air. If unconscious, do not give mouth-to-mouth CPR, and have accidentally, you call 911. Inhaled sodium azide may have residual powder around the nose and the mouth. By giving the CPR, you can expose yourself to that toxic material only, but I still do the compression. Be careful about doing mouth-to-mouth, but call 911, ask for their advice before you do, so that's probably the right thing to do. But remember, when you do mouth-to-mouth, you can have the substance come to your nose and mouth also. Always call 911. Ingestion, do not induce vomiting, that's the most important thing, and call 911 and the Poison Control Center. Thank you so much for watching. Please make sure if you have a kid at home, keep it away from children. Very dangerous substance, and if you suspect or if you're missing, please make sure your children has not taken it, and if you suspect it, please call 911, take it to the hospital right away. Complications are many. Thank you very much.